Hi, this is Dr. Schmoe from the Functional Neurology Center, and today this is a part of our Dizziness mini series. I'm going to be talking about the visual system, specifically the optokinetic system, and how that can lead to changes in brain function and changes in what we call visually induced dizziness. I'm going to share my screen here for a PowerPoint. So basically, an optokinetic, you've probably seen it. It's a red and white strip when we test it clinically, and you'll see different doctors do different visual motion in front of patients. But the optokinetic system, what it really does is it's crucial for keeping the image stable on your retina during head motion and head movement. So you can get optokinetic stimulation from a full visual field in your world. So, say, for example, if you come up to a train and you're sitting still and the train moves by you, you could see with your eyes a slow phase as you follow the train and a quick phase as your eyes come back to pick up another target on the train. And when people have changes in brain function, this can actually lead to visually induced dizziness when the optokinetic system in the brain is not functioning appropriately. People can have trouble dealing with complex patterns on the floor, cars moving by them, people moving by them. When they're sitting still and objects are moving around them, they might feel dizzy. So there can be changes in these optokinetic reflexes that we can assess clinically to see if there's some sort of dysfunction. And we can do that with a bedside examination using our optokinetic strip. We can put somebody on what are called VNG goggles and actually graph your eye movements out. So we can get a good video picture of what your eyes are actually doing with that visual stimulation that's coming by in your world. So the optokinetic system, it's a reflexive ocular motor response. It holds the image of the environment steady on the retina. It has a slow phase with it and then a fast phase that brings your eyes quickly back to the target. And you don't have to know every single thing about optokinetics. I'm just kind of going through and giving you some very basic information. So the optokinetic system, it contributes to the vestibular system when the vestibular system is unable to keep up with rotations of the head. So we know with our vestibular system that we have some different mechanisms in the inner ear that help you detect gravity. When you tilt your head or turn your head or slide forward or left and right or shift, that information from your vestibular system and that gravitational load or acceleration that goes into the brain. And then that lets you know where your head is in space. With traumatic brain injury and whiplash and other injuries, these systems can definitely get affected. And when these get affected, that's when people start to have issues with visually induced dizziness, vestibular induced dizziness. People can also have issues with a mismatch between those systems that can lead to a lot of pain and dysfunction in the cervical spine that you most likely already whiplash. And then that's going to change your brain's perception of where your body is in space and lead to a whole host of potentially bizarre symptoms that might not be easy to understand because it's not black and white like it is in the book. It's not just this vestibular condition or this eye movement condition. It's an integration of how all of our sensory systems function and work together that can lead you to feel like you don't know where you are and make you feel dizzy or nauseous or have some sort of autonomic symptom that could come along. So when people have issues with their visual system, it overstimulates your brain. People feel a lot of fatigue. They feel a lot of anxiety. Overall, you can just feel wiped when these systems are off. Just think about how often throughout the day you have to deal with visual information. It's all day long. All day long, you're dealing with some sort of visual motion. You're scrolling on your computer. You're looking at your phone. You have to have conversations with people. You might be doing something on Zoom and people are doing different motion, different movement. That overstimulates your brain. That leads to some sort of autonomic response, nausea, maybe changes in your gut. You just don't feel good. You feel foggy, you feel dizzy, you feel lightheaded. And that's really our job. I mean, our job is to come in and try and assess these different functions of the visual system and check the optokinetic reflexes and see if there's some sort of dysfunction, and then do different types of rehabilitation techniques to try and get those systems to be better. And we can do that. So we can specifically figure out what is going on, design different rehab strategies that are specific for you, perform rehabilitation, and do different combinations of body exercises, eye movements, vestibular stimulations, rotation, low level laser therapy, run labs, fix up your diet, heal your gut, look at you from a full neurological perspective, metabolic perspective, and a structural perspective, and put that together, and then improve your function and get you doing better. So again, the optokinetic system, it's just an involuntary reflexive eye movement that occurs in response to your visual movement. So visual movement in your world. I've had many people over the last few months that have a really, really hard time just dealing with any type of visual motion. A lot of them have done vision therapy, vestibular therapy, chiropractic, acupuncture. And what I can say for the most part are there's central changes that are occurring in the brain. There's changes in the eye muscles and how they're giving proprioceptive feedback to the brain, and their mismatch with what's going on with the vestibular system. The vestibular system might be not functioning so well, or the structural system might not be functioning so well. So the visual system is dominant. When you have this dominant visual system, when you're getting visual input like optokinetics, or you have to do saccades or pursuits, other types of eye movements, they can make you feel horrible. They can overstimulate your brain and lead to many of the symptoms that we talked about. So with visually induced dizziness, we need to talk about this sensory weighting. So with sensory weighting, you might have a visual system, like I said, that's way too high, a vestibular system that's way too low or not functioning appropriately, and a structural system that maybe you whiplash your neck, you have pain or dysfunction. It's just not giving you the good information to your brain, and now your visual system is dominant. This visual induced dizziness, it's been called by different names throughout the years, such as visual dependence, visual vertigo, space and motion discomfort, visual vestibular mismatch, motorist disorientation syndrome. A lot of people feel horrific when they're out on the road. They're driving, they got other cars coming by. They might feel very lightheaded, or like they're going to faint, or feel like they don't know where their body is in space. They might have to start, touching limbs to give feedback to the brain to make sure that they're not going to pass out. And as of 2009, we call it visually induced dizziness. So patients with visual vertigo, they complain of discomfort, postural destabilization. So with visual information coming by, you might feel like your body is moving, which is extremely scary. And when your body feels like it's moving, then you're going to tighten up. So the visual overstimulation is going to lead to some sort of tightness in the neck, different posturing of the body, and then that can lead to different pain-based syndromes throughout the body. And that can lead to headaches and lead to cervicogenic-based dizziness as well. So people will feel exacerbation of their symptoms in supermarket aisles, crowds, watching moving scenes. And it's not a true like rotational vertigo, but people do feel lightheaded, dizzy, they feel imbalanced, and they just feel disoriented. So, what I like to do clinically to see if there are changes with the visual system and changes in gravitational perception of where you are in space, we actually do a test where we put you in virtual reality. And then you're going to have a line, and you're going to have to take that line and tilt it, take it from here, and try and perfectly find up and down. It's called a subjective visual vertical. Many of the people that we see with visually induced dizziness have changes in their SVV. They're not huge changes, they're slight. And just these slight changes mean that there's something going on with the central vestibular system. And with that sensory reweighting, the visual system is more dominant. And we're trying to figure out and decipher what's going on with this sensory integration in these systems to develop rehab strategies to get you better. So what I want to always ask So what areas of the brain are activated when you're getting this visual information? So we want to assess the different areas of the brain by doing a good bedside examination. We want to watch you walk. We want to assess your cerebellum, do finger tapping, rapid alternating motions, look at all your reflexes, look at, what happens when you walk and you have to think and you have to dual task. Check all of your different eye movements. So check your ability to keep your eyes steady, move your eyes quickly. Can you tolerate this visual motion? See what you look like with your eyes open versus your eyes closed, and try and just get a really good understanding of what areas of the brain are dysfunctional. Develop rehab strategies to make improvements. In our office, we see people commonly over a week period, and we do intense therapy where we're going to see you multiple times a day to try and improve function, to build plasticity, and send you home with exercises to do consistently over a 2-month period with check-ins throughout those 2 months as we tweak things as your brain changes. So the basics of this talk were we're just trying to get a better understanding of the visual vestibular system and the mismatch between these systems that can develop and lead to visually induced dizziness. It's actually really, really common. We see it a lot in patients that just aren't getting better. And, a majority of our patients that we've seen have already tried multiple different therapies. So I hope that helps to give you just some basic information. If you want to reach out, info at the fnc.com or visit us at the fnc.com. We have a resource library that goes through a ton of information, and I would love to hear from you. Thank you.